Hello everyone, myself Satish Brodgi. I welcome you all to KNO Academy YouTube platform channel. Today I am going to teach you some theory part and MCQ part. I request you all to maintain one book or at least one page and pen because I am going to ask you some multiple choice question. Then I will teach you theory part and again I will solve these MCQ question. So you have to tick those questions now. We'll finish theory part and after that again we'll solve those questions with your help only. So we'll go to directly without timing waste. We'll go to first question. The first question is the DSM-5 defines dash personality disorders. In this particular question, the question is asking, according to DSM-5, how many personality disorders are present? The option A is 5, option B is 8, option C is 10, and option D is 13. So you mark your answer, we'll see it later. So next question, a nurse is distinguishing characteristics of schizotypal personality disorder from the schizoid personality disorder. So what is the most appropriate statement by the nurse? In this particular question, the nurse is asking what is the major difference between schizotypal and schizoid personality disorder. So in this question, you have to identify the schizotypal personality disorder characteristics. The first option is schizotypals are characterized by emotional detachment. Schizotypal are characterized by disinterest in close relationship. Schizotypal are indifferent to praise or criticism. Schizotypal have magical thinking or a perceptual distortion. So please mark your answer and we'll go to next question. So next question is a type of personality characterized by an inability to form warm, close social relationship is. So in this particular question, the question is telling there is a personality disorder in that a person cannot maintain a warm, close social relationship, and what is that personality disorder? He is asking. So the option is paranoid personality disorder, schizoid personality disorder, cyclothymic personality PTRE, and histrionic personality disorder. So I request you to mark your answer. We'll go to next question. Next question is, which of the following nursing diagnosis would be the most appropriate for a client with a schizotypal personality disorder? What he is asking, what is the nursing diagnosis for schizotypal personality disorder? Simple. So option A is ineffective coping related to repetitive behavior such as hand washing, risk for self-mutilation related to social anxiety, risk for violence towards others related to lack of remorse for behaviors, impaired thought process related to ideas of reference and magical thinking. So we'll see next question, mark your answers. A client with a paranoid personality disorder is discussing current problems with a nurse. What is the most important intervention for the nurse to implement? There is a paranoid personality disorder patient is there. He is discussing his current problem. He is having some problem. He is discussing with the nurse. And what is the most important intervention by the nurse? The question is asking what the nurse should do. So the option A is have the client look at the sources of frustration. Have the client focus on ways to interact with others. Have the client discuss the use of defense mechanisms. Have the client clarify thoughts and beliefs about an event. So by this one, yeah, I think everybody got to know what I'm going to teach you. My today's topic is personality disorder. So in personality disorder, first I am going to teach you what is personality, and after that what is personality disorders, and what is the classification of personality disorders, and we'll at the last we'll solve some questions and answers. So what is personality? The personality is the unique characteristics of an individual. So it is the unique characteristic of an individual. For example, like a thought process of an individual, behavior of an individual, and the way of speaking with others. For example, thought process, everybody's process will be different, and everybody behaviorals also will be different, and everybody's the way of communication, the way of speaking is also different. So this is the definition of personality. Now what I'm going to teach you is the word personality derived from. Where the word personality derived from. The word personality derived from a Latin word called persona. It includes both mental and physical characters. Okay, the personality includes both mental and physical characters. For example, mental characteristics, as we just now discussed, the behavior of the patients, the thinking capacity, thinking ability of the patient or a person. That is the it comes under mental characteristics. What is the physical characteristics? The how the person is dressed, how his physical appearance from outside, and how is dressed, how well he is disciplined. That is the physical characteristics. So personality just not only depend on these criteria, it also depends on person and the family, even the this one schools and all, and surrounding environment. Everything will be personality will be depend upon. So now what I have discussed, what is personality, and now I am going to teach you what is personality disorders. See, now what just now I have discussed what is personality. We will cross check again. Personality is the way of thinking, feeling, and behaving. The personality is the way of thinking, how the person thinks, how the person feeling, and how the person behavior is, and that makes the person different from other people. So these are all the criteria that will make the other person different from others. And an individual personality is influenced by experiences, environment, and inherited characteristics. As I explained, it depends upon the family, school, genetics, and surrounding environment also. Okay, this is the personality. So what is the personality disorder? What is the personality disorder? It is the what is personality. If you understand the personality, then personality disorder, the definition also will be understand. So see, the personality, what it is saying, personality, it is the way of thinking, feeling, and the behavior. It is a normal, no? What is the way? If it is the behavior, thinking, and feeling is normal, then it is the personality. If the behavior, thinking, and feeling, if it is abnormal, it is unusual, it is strange, then it is called as a personality disorder. What it is? If the thinking of the person, if the feeling of the person, if the thinking of the person, and if the behavior of the person is abnormal, then it is called as a personality disorder. So let's see the definition of the personality disorder. A personality disorder is a type of mental disorder. What it is? It is a type of mental disorder. But the main and important thing is, here there is no need for any treatment, and there is no need for any medical consultation. No need to get admitted in hospital. No need to take any consultation. So it is a type of mental disorder in which you have a rigid. What is rigid? It is a rigid means very solitary and unhealthy pattern of thinking. What it is means, it is a just abnormal pattern of thinking, abnormal functioning and behaving, abnormal behavior. It is called as a personality disorder. A person with a personality disorder has a trouble perceiving and relating to situation and people. He never understand other people only. What it is he is telling, he is having trouble perceiving and relating to situation and people. He never understand the situation of others, he never understand other people, and he can do anything for his benefit. And this causes significant problems and limitations in social relationship. No, he cannot maintain any relationship because the person has a trouble perceiving, he cannot understand other people, so that he cannot able to maintain some relations with other people also, because he is having abnormal behavior is there, abnormal thinking process is there, and abnormal pattern of functioning is there. So this is what it is. In such a way, if you tell means personality disorder, if it is abnormal way of thinking, abnormal way of functioning, and abnormal behavior, yeah, and that lead to what, that lead to a person cannot able to maintain a relationship properly in the society. So in some cases, what will happen, this personality disorder patient, he never accept he is having the disease, he is having the disorder. That is what this slide is going to tell. In some cases, you may not realize that you have a personality disorder because your way of thinking and behaving seems natural to. Yeah, that person thinks whatever he is there, he thinks he is normal only. Whatever behavior seems natural to him only. It is very much natural. It is very much normal to him. He never thinks he is having disease. So, and he may blame for others for the challenges he faces. See, he will blame others for his mistakes. That is what it is trying to tell. So I hope you understand what is personality, what is personality disorder, and the person one who is having personality disorder, he never accept he is having the disease. That is what it is trying to say. So now I already told you, I am going to explain you classification of personality disorder. Before that, I want to tell you something about classification in this one mental health in MHN mental health nursing. There is one ICD and second one is DSM. Okay, what is ICD? ICD is international classification of diseases. What is ICD? ICD is international classification of diseases. Okay, and now the current version is ICD 11. Now 11th version is going on, and one more classification will be there in mental health nursing. That one is diagnostic and statistical manual will be there. Sorry, diagnostic and statistical manual. These two are the criteria where the mental health nursing disorders will be classified. So the DSM is now the current version is 5. Okay, the current version is 5 and ICD's current version is 11. And this is the, you can put a question mark here. They will ask the this one full form and these two. What is ICD? International Classification of Diseases. What is DSM? Diagnostic and Statistical Manual. So for this personality disorder, DSM only given classification. According to DSM, there are three types of three clusters of personality disorder. DSM has divided, for example, DSM. This one is DSM, and DSM has decided decided to make cluster A and cluster B and cluster C. There are three classifications: cluster A, cluster B. These are three. So tell you in next slide. See, this one is according to DSM-5. What is according to DSM-5? DSM-5, what it is made? It made one is cluster A, one is cluster B, and one more is cluster C. So in today's classes, I am going to teach you only cluster A disorders. This cluster B and cluster C will be taught in next classes. Okay. So in cluster A, how many diseases are there? You can see here: paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. These three I am going to teach you in today's classes. So in cluster B, four personality disorders are there. One is antisocial personality disorder, one is borderline personality disorder, one is histrionic personality disorder, and one more is narcissistic personality disorder. So in cluster C, in the same way, there are three personality disorder. One is avoidant personality disorder, one is dependent personality disorder, and one is obsessive compulsive personality disorder. And now I'm going to see. Now in cluster A, how many diseases are there? Three diseases. Okay. And in cluster B, how many are there? 4 are there. Okay. Again in cluster C, how many are there? 3 are there. So in total, there are total 10 personality disorders are present. So we have seen one first question according to DSM-5, how many some personality disorders are present? That answer is 10 personality disorders will be present. And in today's classes, I am going to teach you only cluster A, that is paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. So before that, I want to make you I want to tell you to one thing that I want to make you fix some words in your mind just about these say personality disorder. In cluster A, what we have seen in cluster A, see one second. In cluster A, there are three. One is paranoid. Okay, you can repeat along with me. One is paranoid personality disorder, one is schizoid personality disorder, and one more is schizotypal personality disorder. What is schizotypal personality disorder? So what I am requesting you to, I am going to tell you some words. You have to fix them in your mind. Whenever the question comes, you have to just apply those words. In paranoid personality disorder, I am going to teach you what is paranoid. The word paranoid itself suggests doubting. The person in paranoid disorder, what he do? He doubt. He always think somebody is killing him, somebody is harming him. He always doubt. He's spiteful. suspicious behavior will be there, and what he never trusts others. And this one is paranoid personality. The word paranoid means doubtful, shak karna, sandeh karna. Okay, what it have, what you going to remember? The word is doubt. Okay, doubt or mistrust. Okay, or suspicious, nothing but he's always doubting others. Okay, this one is paranoid. For paranoid personality disorder, you are going to remember these words in your, you are going to fix, anyhow you are going to fix these words in your mind, so that it will be very much easy for you during your examination and question solving. For next this one personality disorder, that one is schizoid personality disorder. The schizoid personality disorder, you have to remember the word is introvert. Okay, introvert or emotional detachment. Emotional detachment. So what is detachment? It is just opposite of attachment. Okay, he never able to maintain any emotional this one relationship with others. There is a flat emotions will be there, the person cannot able to show his emotion. So you have to remember what it is introvert for schizoid. I think you know, everybody know introvert is introvert. Introvert means the person always wanted to be alone, that is introvert. What is schizotypal? For schizotypal, I want you to remember one word called as magical thinking. Okay, okay, magical thinking. You have to remember the word magical thinking. So whenever the paranoid personality disorder will come, we have to remember these words: doubt, mistrust, and suspicious. Whenever schizoid personality disorder will come, you have to remember introvert, emotional detachment, and whenever schizotypal will come, you have to remember magical thinking. So we'll see now cluster A diseases. And see, cluster A personality disorders we are going to discuss in an elaborative manner. So cluster A personality disorder are characterized by odd and eccentric. So what is odd and eccentric? Strange and unusual. These behaviors are very strange and unusual, and unusual thinking or behavior. What is odd and eccentric means? Strange and unusual thinking of the person and behavior of the person. Okay. So now I am going to teach you paranoid personality disorder. See, paranoid personality disorder. So what is paranoid personality disorder? As I already told you to remember some words. What is the person here always thinks somebody is going to killing him. That person, he is always in a doubting manner. He is always suspicious. See, here here only definition only is telling the pattern of being suspicious of others and seeing them as a mean. He believes that what it is mean, whatever he is doubting, he believes that it is true. That person is coming to kill me. See that those two persons are discussing, they are going to murder me, they are going to kill me. See, that person is offering me a food. In that food he added some poison. He is always in a doubting manner. See, spiteful, he is always suspicious, spiteful. And people with a paranoid personality disorder often assume people will harm them. This one is most important thing you have to remember. He always thinks that person is going to kill me. He is coming to kill me. Like that, they think they are always will be in a this one doubtful manner, suspicious manner. They will think the other person is coming to harm him. They are coming to poisoning him. Here he is offering banana, means in that banana also he has added something of poison and all. He wanted to kill me. He is always in a doubt manner. Yeah, he wanted to kill me. He never trust. So he always mistrust others. We have to remember, he always mistrust others. This one is paranoid personality disorder. I hope you understand what is paranoid. In this paranoid personality disorder, the person is always doubting others. He will think the person is coming to kill him. He's in the intention of harming me. He's always suspicious, spiteful, and he never trusts others. I hope you all understood what is paranoid personality disorder. So now we'll go to next slide, and the next this one personality disorder. That one is schizoid personality disorder. So what is schizoid personality disorder? As I already mentioned, I told you to remember one word. That one is introvert. What is introvert? Okay, that word is introvert. What is introvert? That person, he always wanted to be alone. The person with the schizoid personality disorder, he doesn't wanted to maintain any social relationship, any personal relationship. He wanted to be alone. You can remember in your schools, in your colleges, there will be one friend. He always wanted to sit alone. He always will be in a front bench. He never communicate with others. He doesn't want to make any friends. He doesn't show any emotions, expressions. He laughs too much. He always in a like a sad mood. That person will be there. For example, if you want to relate with the one Kannada movie, that one is First Rank Raju. I hope you all seen this movie, First Rank Raju. In that movie, they showed nothing but a schizoid personality disorder. See, you can if you remember that movie. In that movie, the person is he always wanted to be alone in home. He always wanted to study. He doesn't go out. He doesn't want any friends, and he is having very poor IQ. He is good in studies, but that general knowledge will be very less for him. This is the same personality disorder. We'll go through the this one definition and all. In schizoid personality disorder, there will be lack of interest in social and personal relationship. He doesn't want to make any social and personal relationship, preferring to be alone. This one is important. See, he wanted to be alone all the time. He doesn't want to make any friends. Next thing is limited range of emotional expressions. Okay, he never maintain any emotional expression. He never shows any emotional expression. For that, one word will be there. That one is emotional detachment. He completely detached. He doesn't want to show any emotions for anybody. That one is emotional detachment. This is a very important line to remember. Okay, then inability to take pleasure in most activities. He never feel happiness in anything. For the youngsters and all, they will go out, they will play games and all with other, they will gain some pleasure doing that one. Okay, he doesn't get any pleasure from anything. He doesn't get anything happiness from anything. He always wanted to be alone. He doesn't want any personal and social relationship. He always wanted to be alone. If you do anything also, he doesn't gain any pleasure. And inability to pick up normal social cues. What does it mean? Inability to pick up normal social cue means, if I tell my friend like, hello, come, we'll go. I will make like this. What it is mean? We'll go. And I'll say hello, hello. Sometimes I don't say hello, just I will make what it means. It is like hello. In this personality disorder, the person doesn't understand social cues. If I'm making like this, he never understand only what the person is trying to say. For him, you have to say in a word like a hello, hello. Then only he will understand. If we make any cues, any movements, he never going to understand. So this one is the that is meaning. He never understand normal social cues. Next one is appearance of being cold or indifferent to others. What it is mean? Appearance of being cold. What is appearance of being cold? There is a lack of expressions. He never shows any lack of expression. No expression will be shown. It is called as being cold means there is no emotions, flat emotions. What is indifferent to others? Indifferent to others means lack of interest. What it is mean? Lack of interest. He is not having any interest in anything. Okay, this one is the schizoid personality disorder. In the schizoid personality disorder, if you want to remember, you have to remember a word. That one is First Rank Raju movie. He doesn't want to make any social relationship, any personal relationship. He wanted to be alone. He just wanted to be in a room, locked himself with his mobile, with his laptop. He doesn't want to make any friends. He doesn't want to attend any family functions, and he doesn't wanted to make new friends. He doesn't want to go out, and the emotion is very detached, and he doesn't understand social cues. He is having lack of interest, lack of emotions, and he's not having this one. He inability to pick up social cues. This is what about schizoid personality disorder. So we'll discuss now what is schizotypal personality disorder. This one is the third personality disorder in cluster A. What is schizotypal personality disorder? What is schizotypal personality disorder? I already told you to remember. What I told you to remember? What is? Sorry. Okay, 1 second. Schizotypal personality disorder. What is schizotypal personality disorder? I told you to remember one word. What is that word? That one is magical thinking. Can anybody just guess what is magical thinking? Just think what it is supposed to be magical thinking. What is magic? Huh? What is magical thinking, by the way? In this schizotypal personality disorder, the person is always having magical thinking. What is magical thinking? I am going to explain you with some examples. For example, in this one, the person tells, see, within 10 minutes rain will come. Within 10 minutes rain will come. Definitely he will say, today definitely rain will come, I am telling. And he will say, okay, today I wearing red shirt, then I will wear lottery. Whenever he wearing red shirt, he'll say, I will a lottery. Like that he used to. These are the examples I am telling you. And one shopkeeper, who is the shopkeeper, he tells, if I make puja every day, there will be more customers. Before doing puja there will be no customers. After doing puja there will be more customers will come. Like that the person will come. Means he's always thinks that whatever is happening, it's happening because of his saying only. He tell within 10 minutes lights will come. He thinks that if he says only light will come. He strongly believes that the light is came because I said within 10 minutes light will come, then because of that only light is came. And he thinks rain will come. One or two times with a coincidence the rain will come. From that she strongly believes that rain came because I am telling. Because of my saying only rain came. And he thinks that today whenever he wears the red shirt, he will win the lottery. Like that he will think. So, and this person is having, see, magical thinking. What it is means, believing you can influence people and events with your thoughts. What is believing? You can influence people and events. What is influencing people and events? He will tell, see, today if you wear red shirt, you will win a lottery. He is influencing people by saying, what is events? See, within 10 minutes light will come. He will tell, see, today rain will come, definitely rain will come. And if it is not comes, he strongly believe that because of his saying only rain will come. He think he has a strong connection from here to there. See, here the next line is telling, he is belief that certain casual incidents or events have a hidden messages meant only for you. He thinks that there is a messages that are only for him. That raining and all, he thinks that there is a connection between him and that upside, and with the god. He thinks that if I say rain will come means today rain will come. Like that he will think. So this one is the magical thinking. You have to remember this word at any cost. Whenever the magical thinking will be there in the question, that answer is going to be schizotypal. Okay. So now the next is, in schizotypal personality disorder, there are some other characteristics like peculiar dress. What is peculiar dress? That is only unusual dress. Unusual dressing will be there. Wearing formal pant and shirt, and in down he is wearing a slippers. Okay, he is wearing a formal shirt, and there in down he is wearing a jeans pant. Okay, he is having peculiar thinking also, peculiar beliefs and speech or behavior. Very unusual and strange behavior will be there. And next one is odd perceptual experiences, such as hearing a voice whisper your name. Sometimes what he feels means somebody is calling his name in his ear. Sometimes whispering only, not sound, just whispering his name in his voice. But it is completely different from auditory hallucination. It is not auditory hallucination. This one is different because in this personality disorder, he is hearing that oftenly, whenever in twice in a year, twice in a month, very oftenly. It is not continuous. It is connected along with his personality disorder. It is completely different from auditory hallucination. And in this person also, flat emotions and inappropriate emotions response. Why flat emotions? You can think this person is telling everything is happening because of him only. So he is telling that light is coming, that rain is coming. So that other person, the society will not accept him. They will maintain some distance with him. Okay. What in schizoid, what had happened? The person only locked himself. He wanted to be alone. He doesn't want to make friends. But in schizotypal, he wanted to make friends. But the opposite person, they don't want to be his friends because he's always in a magical thinking mode. And what is social anxiety and lack of discomfort with a close relationship? Yeah, because yeah, it is common in every personality disorder. There will be problem in close relationship because this person is having personality disorder, so that they cannot maintain any close relationship along with them. So indifferent, inappropriate, and suspicious responses to others. But suspicious this one responses are actually meant to paranoid personality disorder. Here oftenly it will come. It is mainly associated with the paranoid personality disorder. These two I have explained. He thinks he's having some superpower. He thinks that some events have hidden messages meant only for him. So what we have discussed till now, we have discussed what is personality, what is personality disorders, and what is the classification of disorder, what is ICD, what is DSM, what is current version of those two. Okay, and we have discussed all three: paranoid, schizoid personality, and schizotypal personality. See, from here we have discussed everything. What is personality disorder? The way of thinking, feeling, and behaving. Personality disorder. What is the definition of personality disorder? What is the, in some cases, how the person cannot able to explain, cannot able to think he is having a disease. He never accept he is having a disease. From there, and this one is ICD. The current version is 11. DSM, the current version is 5. What is ICD? International Classification of Diseases. What is DSM? Diagnostic and the Statistical Manual. So here I have discussed these three. There are total 10 personality disorder according to DSM-5. So I have discussed what is personality disorder, what is schizoid personality disorder, what is schizotypal personality disorder. If in question, if the question is explaining the person is harming, mistrust is there, somebody is going to killing, poisoning is there, then it is paranoid personality disorder. What is schizoid personality disorder? For schizoid personality disorder, we have to remember first rank Raju only. That one, he always wanted to be alone. He doesn't want to make any social relationship, any personal relationship. He preferred it to be alone. What is schizotypal personality? The word is magical thinking. You always remember, he thinks that whatever is happening because of his words only happening. These three I have explained. So we'll go to questions now. I hope you all tick the question and answers. We'll see the questions now. Uh, See, the first question is, the DSM-5 defines dash personality disorders. This one I have discussed. I hope everyone is answering this one. Everyone is getting this one. The answer is 10. Okay, the answer is 10. Why? In A, how many diseases? 3. In B, 4. And cluster C, 3 diseases. Total 10 are there. Okay, I hope you understand. See, a nurse is distinguishing characteristics of schizotypal personality disorder from schizoid personality disorder. What is the most appropriate statement by the nurse? In this one, now what is nurse asking? What is the characteristic of schizotypal personality disorder? See, he is asking what is the characteristic of schizoid personality disorder. So now what I told to remember you, schizotypal, magical thinking. So magical thinking, we have to find magical thinking in option first, wherever it is. See, first we'll go to option A. Schizotypal are characterized by emotional detachment. See, emotional detachment. What is emotional detachment? Lack of social relationship, personal relationship. That one is schizoid only. This one is the characteristics of schizoid. Next one is schizotypal are characterized by disinterest in close relationship. No, this one is also a characteristic of schizoid personality disorder only. Schizotypal are indifferent to praise or criticism. They are not ready to praise or they are not ready to accept the criticism. This one is also a characteristic of schizoid only. Okay, see now, schizotypal have a magical thinking. The word came now. If this word came, then this is the right answer for schizotypal personality disorder. So for the right answer for this option is option D. So we'll see the next question. A type of personality characterized by an inability to form warm, close social relationship. What is a type of personality characterized by an inability to form warm, close social relationship? In this question itself is telling the person is not able to maintain warm, close social relationship. What I have told already, social relationship, personal relationship, the person is cannot able to maintain, and the person is emotionally detached. So the option A is telling paranoid. No, paranoid is always doubting, sandeh karna, shak karna. So schizoid personality disorder. Yes, the option is correct. In schizoid personality, the person is wanted to be alone. He doesn't want to make any social relationship. These are I have kept only for just to confuse you. Histrionic personality disorder I am going to teach you in next class. So next I am going to teach you which of the following nursing diagnosis would be most appropriate for a client with schizotypal personality disorder? In this one asking what is the most appropriate nursing diagnosis for schizotypal personality disorder. What is schizotypal? Is magical thinking. Over this one ideas will be coming for schizotypal. We'll see first option. Ineffective coping related to repetitive behavior such as hand washing. No, this is not the schizotypal behavior. It is the OCD, obsessive compulsive personality disorder. What is obsessive compulsive personality disorder? I am going to teach you this one in next class. Okay, in this person, what the person is going to wash his hands so many times. He always wanted to be perfect. He always wanted to be perfect. That is the obsessive compulsive personality disorder character. Option B, risk for self mutilation related to social anxiety. This is not the characteristics of what it is, schizotypal. Risk for violence toward others related to lack of remorse for behaviors. Risk for violence towards, he always wanted to harm others for his own benefit. This one is the characteristics of antisocial personality disorder. This is the antisocial personality disorder characteristic. This is not the schizotypal. See, you can see impaired thought process related to ideas of reference. Whispering, I told you, sometimes whispering will be there. And magical thinking. See, magical thinking. If this word comes, this is the characteristic of schizotypal personality disorder. So option D is the correct answer. A client with a paranoid personality disorder is discussing current problems with a nurse and what is the most important intervention for the nurse to implement. In this question, the questioner is asking a person with a paranoid personality disorder is sharing his current problems with a nurse, and what is the important nursing intervention that nurse should implement on this current problem, whatever the situation the patient is explaining, what the nurse intervention should be applied. Okay, the option A is saying have the client look at the sources of frustration. The option is A is saying look at the sources of frustration. There is no use for looking at sources of frustration. By this one, the current problem of the paranoid personality disorder patient will not be solved. So what is the problem of the paranoid personality disorder? He is always thinking somebody is going to kill him, somebody is harming him, he is always in a suspicious and doubting manner. So with removing all the sources of frustration, that criteria will not be fulfilled for this along with this option A. Okay, we'll see the option B. Have the client focus on the ways of interact with each other. So this one cannot able to form only because this person always in a doubting manner only. He is always see every person with a doubt. So nobody will interact with him. First of all, nobody wanted to interact with him because always tell somebody offer him a food, he will tell there is a poison in that one. So in that's why if he wanted to also, the other person they don't want to interact with him. So option C is saying have the client discuss the use of defense mechanism. By using defense mechanisms, he cannot able to solve the problems of the paranoid personality disorder. So we'll see what option D is saying. So have the client clarify thoughts and belief about an event. Yes. So what is an event? See, the person is telling, see, somebody is coming to kill him. See, those person coming towards me, he is coming to murder me, he is coming to kill me. It is an event. So what is the nurse's work? She has to clarify this patient's thought. The nurse should tell, she has to sit beside with the patient, along with the patient, she has to tell, say that person is coming, maybe he is not coming to kill you, I am here only, I am along with you only, nothing will happen. By that one, nurse should clarify the thoughts of the paranoid personality disorder patient. So we'll see the next question. We have brought some important questions regarding this personality disorders. We'll see one by one. We'll see them. One is this one. Schizoid and schizotypal personality disorders may be distinguished only by the presence of which of the following symptoms in schizotypal persons. See what he is asking. What it is characteristic of schizotypal person only is asking. Okay. What is asking? What is the characteristic of schizotypal persons? See, indifference to others. What is indifference to others? I have explained in schizoid personality disorder. There is a lack of interest will be there. What is indifference to others? Lack of interest. There is no interest in person. That one. That's why this is a schizoid personality disorder. So visual hallucinations. There will not be visual hallucinations. Will be there. Flat affect and little overt emotions. No, this is not the option. There is not little overt. There will overly odd behaviors will be there. For example, magical thinking will be there. Yes, no? Magical thinking also will be there. Magical thinking is there. The person thinks the rain is coming because of him only. Whatever is happening, it is happening because he is saying that is happening. He is thinking like that. So this is the, what is the
Answer option D, overtly odd behavior is the answer. So we'll see the next question. See, which of the personality disorder is most appropriate for Joy? He lives alone in a cabin. See the word what it is saying. He lives alone. See, by this one also I think most of you got the answer. He lives alone in the cabin in the woods where he does the minimum to get by. And when approached, okay, he lives alone. If somebody goes to him for speaking and all, he responds appropriately, but is not interested in conversation or making friends. See, what is Joy? Joy is living in a some wood home, and in that one he is living alone. If somebody come to approach him, want to make some friends, but he doesn't accept that. So what is the answer? In schizotypal, no, schizotypal there will be magical thinking is there. He wanted to make friends, but the opposite person doesn't want to be his friend. Yes, option, of course, option B is the correct answer, because he wanted to be alone and he doesn't want any social relationship and any personal relationship. So paranoid personality disorder, I have explained so many times, this is a doubtful and a spiteful, suspicious behavior will be there. In borderline and all, I am going to explain you in cluster B, and cluster C I am going to explain you next classes. So we'll see the next question. See, if you want to answer this question, you just make pause and answer, then see my explanation. Okay, an individual with a schizotypal personality disorder, see, schizotypal personality disorder will usually exhibit which of the following characteristics? So what he is asking? What is asking about schizotypal? What is schizotypal? I told to remember some word, magical thinking, raining is there, everything happening because of me only, you know. See, option A, eccentric behavior. Eccentric means unusual, odd, strange. Eccentric behavior marked by odd patterns of thinking and communication. Yes, there will be strange behavior will be there in schizotypal personality disorder. Discomfort with a close personal relationship. Yes, there will be discomfort with a close personal relationship, because in this one schizotypal personality disorder there will be magical thinking. He's like everything is happening because of me only, and there will be peculiar dress will be there. Okay, that's why there will be discomfort with a close relationship also will be there. Often exhibit unusual ideas of reference. I have already explained, there will be whispering of voice also will be there. Yes or no? Whispering of voices will be there in his mind. So ideas of reference also will be there. So answer of this question is answer D. Okay, answer of this question is answer D. So next question is the personality disorder that is characterized primarily by mistrust. Okay, I hope you understand what is the answer. The personality disorder that is characterized by primarily by mistrust. Okay, what is primarily by mistrust? See, the option A is the correct answer, because in paranoid personality disorder the patient he never trusts anyone. There will be mistrust will be there. I told you to remember the word. In that one mistrust also was there. Okay, mistrust is always doubtful. Okay, doubtful, and he is suspicious. What is he suspicious? Okay, sandeh karna, shak karna. Okay, what is next one is antisocial personality disorder, dependent personality disorder, and schizotypal personality disorder. These two I am going to teach in next class. Schizotypal I explained, there will be magical thinking will be there. Okay, next question we'll see. Okay, see, a personality disorder in which an individual suspect of other people are harming him. What he is thinking? There is a personality disorder is there. In that personality disorder, the person thinks the people are harming, the people are coming to poison him. See, in that food the poison is there. Those two are discussing, they are planning to murder me. He is always in a doubtful manner. The option will go to directly without wasting time. The option A is the correct answer. What it is? Paranoid personality disorder as there. These are nothing but. Okay. And the last question of our session. After this one, we will close our session. Okay, I hope you will all understood our topic. Okay, we'll see the question. Which of the following is not a characteristic of individual with a paranoid personality disorder? See, we have to see the question very correctly, because he is asking which of the following is not a characteristic of character. He is asking which is not. Okay, which is not a characteristic of individual with a paranoid personality disorder. See, option A, B, C, D is given. In that one option is not belong to paranoid personality disorder. See, we'll see the option A first. Avoidance of close relationship. Yes, because this person is always in doubtful manner. Okay, that's why there will be no close relationship will be there. So option A, it belongs to paranoid personality disorder. So avoidance of public areas, no. This person cannot avoid public areas. He will go everywhere, wherever I want he will go. Okay, he will always go. He doesn't make any such thing like avoiding public places and all. So we will see the option C. Are often spontaneously aggressive to others. Yes, are spontaneously aggressive. Sometimes he will be aggressive because he will think somebody is going to harm, means with a defense mechanism he thinks he replies aggressively to others. So of course it belongs to the paranoid personality character only. We'll see the option D. Often feel that they have been deeply and irreversibly betrayed by others. Yeah, yes, of course. This is the main thing about paranoid personality disorder. He always deeply think and irreversibly. Okay, it is fixed in them, in their mind, that somebody is harming, somebody is betraying me, always doubting others. So this is all about we have discussed. So which is the answer? Answer B is the correct answer, which is the not belong to paranoid personality disorder. So I hope you all enjoyed my classes. I hope you will show some support and all. So what I tell you is, with this class there will be no single question will be out of this syllabus. So whatever the syllabus is there, I have covered everything. So if you go through the class very nicely, with attentively, you can solve all the questions very easily. So thank you one and all. Thank you.